If you've been treating heartburn but ignoring snoring or other OSA symptoms, you may be missing the bigger picture. Can reflux cause sleep apnea? The careful answer is reflux probably does not explain all sleep apnea in and of itself, but it can absolutely contribute to it, worsen it, and aggravate the upper airway, especially when laryngopharyngeal reflux is involved. And the evidence supports a real relationship between these two conditions. A 2023 systematic review found a significant association between GERD and OSA. And a 2021 meta-analysis found that treating OSA with CPAP significantly reduced reflux events. LPR also appears to be common in OSA patients based on meta-analysis data. So, if you've been treating heartburn but ignoring snoring or other OSA symptoms, you may be missing the bigger picture. Are you or your loved one dealing with reflux, sleep apnea, or both? Have you noticed that these symptoms seem connected, especially at night? Let us know your experience.